Hi, I'm Dr. Grobelny. I'm a chiropractor. I've been in practice for 19 years. I'm an ICAK board-certified professional applied kinesiologist. And what that means is that I have the ability to evaluate the body's responses immediately to any kind of treatment or therapy that we intend to use. I found these FlorAlive remedies over 4 years ago at the ICAK conference, and since then have been using them to help deal with my patients' emotional and thought pattern problems, which ultimately, as we know, what you think can affect your body and your entire life. These remedies work, in my mind, they work at a quantum level. They create a quantum event which not only changes how a person feels about themselves, but literally can help them change their life, because as we know, what we think affects the reality around us. Specifically on a therapeutic basis, these remedies have been so valuable in supporting specific emotional problems and thought patterns that then affect acupuncture meridians, which then affects organs, glands very specifically, and therefore the muscle patterns that relate to those. So I found in the 4 years that I've been using them that all the other remedies I have used in the past, including specific clearing techniques, emotional techniques, the other remedies have become so far distant in effectiveness compared to what the FlorAlive remedies have been doing. And as myself, I've also been a patient of these remedies. As a patient, I've had situations of personal loss, situations of extreme stress that I've had to deal with when dealing with some personal problems and family members, that these remedies I have found immediate change, and have been so excited about them that even the doctor in my office, my associate, has responded so well to these remedies that he's become excited about them. So I highly recommend them for physicians. Use them, try them, see what it does with your patients. Long-term changes, I've noticed, have been excellent. For patients, take them as they're directed, and they will make a difference. Sometimes it's subtle, and sometimes it's immediately noticeable. I give an example of one patient in particular who, for years, dealt with depression and dark thoughts of suicide, and confided in me one day. She said, I guess I just like to be depressed, and I just like to be unhappy. When we found the remedies, and I started using the remedies with her, within a 3-week period, when I asked her how she was doing, she said, well, I think I'm doing better. But when I talked to her parents said, oh, she's happy. She's actually gone on the first date she's had in around 10 years. So these remedies have far-reaching effects, and I highly recommend them.